Our first speaker is Dr. Shahroz Merchant, and you're in for a treat. Dr. Merchant is a medical oncologist with over 10 years of experience in the NHS. She completed her degree in Guy's and St Thomas's Hospital, and she went on to complete her PhD, a higher research degree, exploring novel ways to image breast cancer. She has extensive experience in chemotherapy, immunotherapy, treating both breast and lung cancer. She currently works at Imperial College NHS Healthcare Trust, as well as Northwest London Hospital. So please join me in welcoming Dr. Merchant.
Yali Madat, everyone. I'm Shahroz Merchant. I'm an oncology consultant at Northwick Park and Imperial College, as Hafiz mentioned. And I'm here to talk about cancer. Now, when I mention the word cancer, everybody, we still have a little bit of stigma associated with cancer. And I think that because cancer is so common, we have to be a bit more knowledgeable about it. Also, we have to share our experiences, because I'm sure that at least, many of you either might hopefully have not experienced cancer, but know somebody who's experienced cancer or been through it. So I think raising awareness is really important. And as Hazriman mentioned in his Farman, which you heard earlier this evening in Jamatkhana, these are non-communicable diseases that we must be mindful of. They're insidious, and we have to monitor our health really carefully, and especially monitor ourselves with health checks regularly. So I'm going to talk a bit about cancer today. So what is cancer? Cancer is when there's an abnormal growth of cells. So a cancer cell starts out as a normal cell, and then due to some environmental or genetic factors, it starts to become abnormal and starts to grow rapidly. Cancer has the tendency to then spread. There's about 200 different types of cancer. And the current statistics from the Cancer Research UK website says that 1 in 2 people in the UK will get cancer at some point in their lifetime. So, this is a really important statistic. We have to do something to minimize our risk as much as possible. The good news is that 50% of us will survive cancer for 10 years or more. So if we diagnose cancer early, there's a good chance that it becomes a chronic condition, that's something that we can live with for a long time. And 38% of cancers are preventable. And I'm going to talk about how we can prevent cancers. The 4 most common cancers that I'm going to talk about today are breast cancer, that's the top cancer in women. In men, the top cancer is prostate. And then the following second cancer that's common in both men and women is lung cancer, and then followed by bowel cancer. So those are the top 4 common cancers that I'm going to talk to you today about. We know that 4 in 10 cancers can be prevented. So here, this is from Cancer Research UK again, the bigger the circle, the higher this is the risk of causing cancer. The biggest cause of cancer, smoking. We need to learn to be smoke-free. If anyone needs help with sort of stopping smoking, there are lots of facilities that GPs can organize to enable that we can be as smoke-free as possible. The next biggest thing to cause cancer, obesity. So we need to focus on maintaining a healthy weight as much as possible. Eating fruits and vegetables. We know that a diet that's high in fiber reduces the risk of cancer. We need to stick to at least 5 a day if we can of fruit and vegetables. We need to drink less alcohol. Alcohol is a big culprit in cancer. We need to be sun smart. We need to protect ourselves from the sun. We know that processed and red meat can increase the risk of cancer as well. So if we can minimize that as much as possible, we should focus on that. And then, as I've mentioned, a diet that's high in fiber. We need to be more active, have less salt. And then there's other factors such as, minimizing infections such as hepatitis B, C, minimize risk that's worse, such as asbestos exposure. The other way that we can prevent cancer or catch it early is through our NHS screening programs. Currently, there are 3 screening programs: breast cancer, cervical cancer, and bowel cancer. And all the screening is really important to pick up cancer at an early stage and therefore be more curative. Breast cancer screening program is offered to women over the age of 50, and women are offered screening every 3 years. And by 2012, the plan was to extend it from 47 to 73, and across the UK they are increasing the range of women being offered mammography. Cervical cancer screening is normally offered at the age of 25, 3 yearly, and then after that, after 50s, every 5 years. After the age of 65, you can request screening, as can women over the age of 70, they can request breast cancer screening. And the bowel cancer screening occurs, you get offered that at the age of 60 years. It involves sending a stool sample to the lab where they check for blood in the stool. And then if there is blood in the stool, you're invited for further tests like a camera test to detect if there's a cancer or a precancerous growth. Interestingly, the statistics from the screening program show that there's only a 70% uptake of screening. I'm sure our Jamaat is really aware of the screening program, and hopefully those statistics don't involve us. But if there's any one of us who's a bit reluctant to go on screening, I highly encourage that we attend screening and improve the statistics, both in terms of picking up cancer early, but also improving our survival from this. So I'll talk about the main cancers first. Breast cancer, as I said, is the most common cancer in women. It affects 1 in 7 of us. The older we get, the higher we are at picking up, the higher risk we are of getting breast cancer. So age is the biggest risk factor. We know that people who have a family history, there's a genetic reason. So if you have more than one family member affected by breast or prostate cancer, speak to your GP about whether there could be a genetic link there. There has been a lot of press about hormone replacement therapy, or HRT. A lot of women, as they get into the menopause, require HRT for their general well-being. So it helps with improving bone health, it helps with preventing heart disease. But we know that there is a risk associated. So if you've got a family history of breast cancer, speak to your GP, ask them about the pros and cons, because HRT is important for women's well-being, but at the same time there is a small risk associated with having cancer. But if I put that in context, if I look at 1,000 women with breast cancer, we know that about 24 women will get breast cancer out of those 1,000. An additional 24 women will get cancer due to obesity. Only about 4 women extra will get cancer due to HRT. So you can see the relationship with HRT and breast cancer. Yes, there is a risk, but not as big as obesity, alcohol, etc. Breasts should be checked regularly. Even in between mammograms, we should be checking our breasts regularly. If you are not sure how to check your breasts, if you want some more advice, I'm more than happy to speak to any Jamaati members after this talk and discuss how to self-examine. And we have some leaflets at the back as well. So we should be looking for any change in our breasts, any change in the shape, size, change in the skin, change in the way that the nipple looks, any dimpling or lumps. This is quite a good sort of poster that came out in social media, and I thought it was really good. It says, let's talk about lemons, and so it kind of depicts sort of what we could find on breast cancer when we examine our breasts. So we can see a thick area, we can see a lump, there might be a dimple on our breast, a growing vein, nipple crusting, a sunken nipple, it could be red or hot, nipple discharge. If it looks like it's orange peel skin, these signs are all of advanced cancer. We don't want to get to this stage. We want to pick it up much earlier than this. So this is, if you look this up, it's a poster called Talking Lemons. So if you want the reference, I can always provide it after the talk. In men, prostate cancer is the biggest cause of cancer. It can develop it in any age after the age of 45, but typically the average age is between 70 to 74. Those who have a family history are at higher risk. There is no screening program because the only way of detecting prostate cancer is through a blood test called a PSA. But that blood test can be artificially raised if one has a urine infection, one has an enlarged prostate. It doesn't necessarily mean cancer. But if men notice a change in their stream of the urine as they get older, it's always advisable to check with the GP. Anyone over the age of 50 can request a PSA blood test. But it doesn't automatically mean cancer if the PSA is elevated. Lung cancer is the second most common cancer in men and women after breast and prostate cancer. Typically, when one has lung cancer, it's usually at an advanced stage because it starts to grow and then causes symptoms such as cough, breathlessness, weight loss. We know that 70% of cases are caused by smoking. There is a drive towards lung cancer screening, so doing what's called a low-dose CT scan in smokers currently. There are trials going on across the UK to see if we can implement this across the whole of the UK, but currently there's something called a lung health check across the UK. So if anyone is aged between 55 and 75 who's had a smoking history, you want to go for this lung check, you can request it through your GP. And essentially what it does is it's like a blowing test, and they look for certain chemicals in that blowing test, and if it's positive, then you get referred for a CT scan. So it's a good way of detecting lung cancer at an early stage. But at the moment we don't have screening, but this is something that we're sort of driving towards. What about e-cigarettes? Might be a question about that. E-cigarettes are becoming quite a popular thing these days. The good thing about e-cigarettes is that they don't have tobacco in it, which causes cancer, but they do have nicotine in it, and nicotine can be addictive. So at the moment, e-cigarettes are supposed to be a way of stepping down from cigarette smoking rather than encouraging, although it has become quite fashionable in the younger age now, but we have to be careful that it's associated with addiction, but not necessarily cancer. So I think the jury's still out about e-cigarettes. The other thing I wanted to mention while we're on lung cancer is pan. Pan doesn't cause lung cancer, but it causes mouth cancer. I know, we are a Jamaat that probably likes a bit of pan, but regular pan has tobacco, and it can increase the risk of oral cancer. And I just wanted to quickly also mention shisha smoking, because again, I don't think there's enough awareness about shisha. So these are a few facts from Brand Council. Shisha has cancer-causing chemicals. Shisha contains tobacco. Shisha can give you oral herpes because of sharing of shisha pipes. And shisha smoked for 45 minutes is equivalent to smoking 100 cigarettes. So please, be mindful that shisha smoking is not without its risks. Even if you go to a restaurant and they tell you it's tobacco-free, I would double check that because I wouldn't trust anyone. Shisha is associated with quite significant problems. And shisha can cause gum disease, bad breath, tooth loss. So just as much as smoking is a hazard, so is shisha smoking. Sorry? Or sapari, yeah, that's part of pan. And lastly, I'll just talk quickly about bowel cancer. I might be running out of time, sorry. It's the fourth most common cancer in the UK, affects both men and women. Usually, majority of cases, 80% occur in people over the age of 60 years old. If you notice any bleeding associated with your stool from your back passage, any change in your bowel habit, if you've got more looser, frequent stools, it's going on for more than 6 weeks, please see your GP. If you've got a pain in your tummy, a lump in your tummy, weight loss, unexplained tiredness, again, these are all symptoms of bowel cancer. I just wanted to show finally this leaflet, which you can pick up at the back. And it's really good. It's by Macmillan, and it talks about the symptoms and signs of cancer. And it's got a sheet at the front for the women, at the back for men, and it talks about all common symptoms of cancer. So it's quite, wallet size. You can pick it up from the back. So finally, just to say, cancer is not, it's not something that is terminal these days. As I said, there is a really good chance that if caught early, it can be cured, it can be put into remission, it becomes a chronic illness. There's a lot of people involved in your care. There's been a bit of research recently about also that people are a bit reluctant to go to a GP because they don't want to bother the GPs. They feel GPs are very busy these days, they can't go to a GP. So there is some, there's some reluctance to go to a GP. Oh, shall I worry the GP about, something, a small symptom? And I think that if you're concerned that something's not normal for you, if you're worried about any symptom that I've discussed today, you can always look it up or go to your GP and seek some advice, because the earlier we seek advice, the earlier we can diagnose and treat. And there's lots of people involved in treating cancer, from your GP to the oncologist. geneticists, specialist nurses, allied professionals. And of course, we have lots of support from our Khane, our Macmillan support workers, and our Jamaat. So I think, there are lots of treatments. I'm not going to go into the treatments of individual cancers, but we've come a long way, and we have lots of good treatments these days for cancer, and it can become a chronic condition. So these are my references, and I just want to say thank you for letting me speak today.
Please welcome Dr. Zareen Sheikh.
Thank you, Hafiz, for that very kind introduction. Can everyone hear me at the back? Yes. Okay, wonderful. So my name is Zareen, and as Hafiz said, I am a consultant cardiologist, and I have 18 years experience in the NHS. Now, I'm actually a very passionate advocate of the power of lifestyle medicine to not only prevent, but to reverse heart disease. And I'll tell you why and how I got to that conclusion. And I think just to put everything into context, and to put into context why I'm here talking about prevention, I think it's only fair that I really share with you my story. So, as I said, I qualified 18 years ago into a busy, very fast-moving, fast-paced life. There was lots of stress, but there was lots of, satisfaction with what I was doing, and I loved it. I loved it for a very, very long time. But I didn't realise that slowly, what was building up was fatigue. What was building up was neglecting what I was eating, neglecting my sleep. And I just thought, I'm invincible, this is fine, I can cope, get on with it. But about 3 years ago, I started getting physical symptoms. And I thought, I don't quite understand what's going on, I'll go and see the GP. So I went and saw the GP, I got some medication, that didn't really help. Everything carried on, the physical symptoms got worse. I then ended up in hospital for a period of time as well, because no one really knew what was going on. And one of my friends took me aside and said, Zareen, have you actually looked at your life? You're not sleeping properly, you're not eating properly, you're not really exercising, you're not looking after yourself. I'm not surprised that you've now become unwell. So maybe you should actually look at yourself and think about how you can change. And so I did. I was going to finish my training at the beginning of 2017, so I thought, right, I'm going to take a month off. I looked at all the medications that weren't really helping me, and I do not advocate doing this, but I stopped them. I don't advocate anyone doing this without a doctor or a GP's approval, but I thought, right, they're not helping. And I was really looking forward to my month off, and the day that I finished my training and the day I knew I was going to have a month off was the day that all my symptoms vanished. And I mean vanished. And they haven't really come back again. And so for me, that was a really eureka moment. When I focused on my sleep, when I focused on my stress levels, when I focused on what I was eating and how I was living, I could reverse physical symptoms. And so that's when I started reflecting on how I was treating my patients. How am I, what am I seeing on the ward? And I realized that as a cardiologist, 80% of what I see is preventable. And what we're excellent at in the NHS is treating acute disease. So if someone has a heart attack, we've got all sorts of wizardry and stents and whatnot to, save them. But the moment it then becomes slightly more chronic, we tend to treat the symptoms. We don't often try and look at the root cause. We put a bandage on the symptom and say, right, we'll see you again in 3 months. And I really started to reflect on the way I was seeing patients, and I had a sort of almost 180-degree total turn in what I was doing and how I was practicing. And what I then thought of was, well, what are the key principles? What are the key elements that I'm telling my patients? Because, I was then focusing more on what really caused the high blood pressure, or really caused that weight gain, or really caused the diabetes. And I was getting amazing results. And it wasn't massive changes. It was small, achievable steps. And So I thought of something called the Fresh Heart Project, where the fresh forms an acronym, and all those letters really form the pillars of what I think are the basis of good, not just good heart health, but good health and well-being. And you know, you can extrapolate it to lots of different conditions and diseases. So I'll go through this one by one, and then obviously you can ask me questions at the end. So the F stands for food. Food is information that we give our bodies, okay? Food is so important. And I'm not going to take away the thunder from our next speaker, so I'm not going to talk about it too much. But essentially, we all know what we need to be eating. We need to be eating fresh food, we need to be eating whole food, we need to be eating loads of fruit and vegetables. And we need to eat the rainbow. So, you know, if we have colourful fruit and vegetables on our plate, we know that we're getting such a large, wide variety of nutrients. We all know that, you know, processed food and cakes aren't that good for us. But I will say that we have to live. And, you know, if we're good for the majority of the time, then you're allowed that day off, because we have to live. I'm not going to talk too much about what we should eat, because what we're also learning a lot about is something called the gut microbiome. Now, does anyone know how many cells make up the human body? It's a lot. 30 trillion. Does anyone know how many bugs live on or in us? Is it more or less? What do you think? More. 100 trillion. So there are 100 trillion bugs, and the majority of those live within our gut. And when you get that, you know, that gut feeling that something's wrong or something's right or something's not quite happening, you know, there's a theory that those bugs are actually, you know, for sending messengers, chemical messengers up to our brain that give you that feeling. And so when we eat, that determines what we eat determines what kind of gut microbiome we have. If we eat loads of processed sugary foods, then those bugs proliferate, and they're not so good for us. And we're literally just scratching the surface of our knowledge here, but watch this space. The other thing we know about the gut microbiome is they all have a rhythm. Like we have a circadian rhythm, they all have an internal clock, and they need to rest. So if we're eating at all hours of the day into the night, then we don't allow our gut bugs to rest. So what I would say is it's not only about what we eat, it's about how we eat, but also when we eat. So if we restrict our eating into, say, I would say it's an achievable time window is 12 hours, then we allow our gut bugs to rest, and we allow our gut to rest, and we don't put on as much weight, even if we're eating a bad diet, because our gut bugs are resting. So I just want to leave you with that, because if there's one thing that you change about the way that you eat, if you eat within a restricted time window, then that's really good for your health. And the other thing I would say is just, you know, people with good habits do better. So just make it really hard to eat bad food. That will make it a lot easier for you. Now, the second letter of the fresh is for relaxation. So we're living in a world where we do not switch off. We have phones. I mean, how many of us check emails late into the night? How many of us, you know, wake up in the morning and grab our phones and pick it up and say, oh, I wonder who's called or what we're doing? We don't allow our minds to rest. And that is so vital for us. It's vital because we need our body and our brain time to relax and process stress. Now, on the subject of stress, is stress good? No. So, acute stress is good because it's protective. So when we were evolving, if we saw a saber-toothed tiger, then we would have an acute stress response. So our blood pressure would go up, our heart rate would go up, we'd get ready to run, okay? And that's protective. But then when we ran from that danger, everything would kind of settle and we'd get back to normal. And that's what we're evolved for. We're evolved to run from danger, protect ourselves, but we're not evolved for that constant pinging of the email inbox and those constant messages that we haven't answered, and the constant whirring of those thoughts around our head, because that gives us chronic stress. And chronic stress is just a chronic activation of that nervous system, of that fight or flight response. And that is not good for our heart. That is something that we need to protect ourselves from. And so what I would say is relaxation, or finding that special thing that just takes you away from it all, will help with your stress levels. And realizing that you are stressed is a big part of the battle, and then you can figure out how to deal with it. We've only got 10 minutes. This is a talk on it in and of itself, so I'll move on to the next letter. Oh, sorry. Exercise. Exercise, we all know it's good for us. It makes you happier, it makes you live longer, it protects you from pretty much every disease. It's amazing. And I would say just do something that is achievable. And anything is better than nothing. How many of you have a gym membership or a regular form of exercise that you... Can I have a show of hands? Brilliant. I have a gym membership, I don't use it. But the key is to make it enjoyable, have some accountability, do it with friends, do something that you enjoy, and really, that's half the battle. And anything is better than nothing, and everyone's different, so do not worry. We don't want you to all be running marathons. It's just taking those small, achievable steps. Anything is better than nothing. Now, this is a very favourite topic of mine because I spent 3 years measuring sleep in my PhD. Sleep is nature's miracle cure. I cannot stress how important it is for every system within our body. It is like our Control-Alt-Delete. We need it, it's vital. And it helps in so many different things. It helps us process our memories. It helps us get rid of all those toxins in our brain that have accumulated throughout the day. It helps us reset our hormones, and with that, it helps us to maintain good blood pressure. Interestingly, it helps. Obviously, we all know how we feel after we haven't slept well. We feel rubbish. It improves productivity, but it also improves creativity. And companies like Google or NASA have realized that it improves creativity, and they're actually allowing they allow their workers very generous sleep times, and they actually have sleep pods built into their offices so that if you're tired you can go, because they've realized the value of sleep for productivity and for creativity. For the heart, it is a period of metabolic restoration. The heart has to work so hard all day that it gets a chance to relax. Blood pressure goes down, heart rate goes down. So it's so important. 7 to 9 hours, that's roughly how long you need. And happiness. So you might ask, why is a cardiologist talking about happiness? Well, psychological well-being is so intrinsically linked to cardiac health. This is a picture of me very happy with my family. I don't want to sound insensitive. If someone's going through a really difficult time, a bereavement, some real trauma, then me talking about happiness can sometimes sound a bit insensitive, so I really don't want that, and there are avenues that you can access for help. But psychological well-being and happiness is so important. There are lots of studies that have shown that the happier you are, the more positive you are, the more optimistic you are, the better your heart health. Now, is happiness a choice? What do you think? Yeah, it can be. I mean, who listens to the news every morning? How does it make you feel? Is the news positive or negative? Negative. And what sort of frame of mind does that put you in? Yeah. There have been studies that have been done looking at this, and they've said that if you eat just 3 minutes of negative news in the morning can mean that you're 27% more likely to report a negative day 6 to 8 hours later. So it sits with you, it stays with you. How many of you wake up in the morning and are thankful and have a practice of gratitude? I didn't, but I did, and it's revolutionary, and there have been studies on this. So there's a study that I love in MS patients, and they were told to do a gratitude journal for 6 weeks. So for 6 weeks, they got up and they wrote what they were thankful for every morning. And 6 months later, 50% of them were on less pain medication. So it really does sit with you, and it really does help. And it is sometimes a choice, and it is the lens through which we frame our lives. Is it contagious? Yes, absolutely. So if you look at whoever's sitting next to you and you smile at them, you cannot help but smile back. And that's because we have something called mirror neurons. And if I smile at Hafiz and he smiles back at me, if I'm not smiling and Hafiz smiles at me, my mirror neurons are telling me to smile. So if I don't smile back, then I'm fighting my motor neurons, which is my action neurons, they're fighting my innate mirror neurons. And this is how we've survived as a species, because we connect to each other. We all, we have this ability to mirror each other. How many of you have yawned and someone else has yawned with you? How many of you have tapped your foot at a airport waiting at the gate and then everyone else becomes anxious? It is because these feelings are contagious. So smiling, can sometimes really make a difference. And the last bit that I feel is fundamental to happiness is community. And it's this connection that we are neurobiologically hardwired to have. And that's why, I'm so proud to be part of the Smiley community, because it's a tribe, it's a community. We all have a sense of purpose and belonging, and we can get real strength from that. But loneliness is a real issue, and it's, Theresa May, when she was Prime Minister, appointed a minister for loneliness. I think that's quite sad, but I guess quite good in a way. So happiness, I think, is one of the key pillars, because without that, I think everything else will fall apart. So, how do you get a fresh start to your heart? Food. Eat a healthy diet, but eat it in rhythm with your body. Relaxation. Find that thing that brings you inner joy, inner peace. And for a lot of us, that can be attending Kanu. Exercise, make it enjoyable. Sleep, I haven't had a chance to talk about my top sleep tips, but I can answer any questions at the end. But light, caffeine, temperature, these are all important. And happiness, it's all about really giving yourself permission, and giving yourself permission to enjoy life to the full. And certainly, when I started giving myself permission to heal, and when I started giving myself permission to put my own oxygen mask on first, and it wasn't, I've still got a long way to go. I talk about small achievable steps, and it is really small achievable steps. But when I started focusing on myself, I became a better doctor, I became a better mother, and I became a better, wife. And so I'm so passionate about spreading this message, because I really do believe that we can empower ourselves to live a life that we love, and then we won't need to worry about all these diseases. So I want to leave you with this, that great change does really come with small steps, and that will really empower you to live a life that you love.
Join me in welcoming Dr. Shah.
Hi everyone, it's a pleasure to be here. Thank you for having me here. It's great to see so many people here. It's just amazing to share this message, and you've already had two wonderful speakers and colleagues of mine. So, overweight, type 2 diabetic with high blood pressure and high cholesterol. My family friend, Mr. Luha, went to his GP in the summer of 2017, aged around 60. He complained of chest pain and feeling breathless when he was physically active. So his GP thought he may have angina. So the GP referred him on to see a heart specialist, a cardiologist, who did several tests. And one of the tests that was done was an angiogram. Now, an angiogram is an investigation where you have a dye put into your blood, and then it's able to show you how healthy the blood vessels are that are supplying your heart. What his angiogram showed was that 3 of his blood vessels were severely narrowed. So let's just have a brief look at what these blood vessels are. So, these blood vessels that you see here are known as the coronary arteries. And the coronary arteries are supplying oxygen and nutrition to the heart muscle. The heart muscle, just like any other part of the body and any other muscle in the body, needs oxygen and nutrition in order to function. So, here's what a good angiogram will look like. So as you can see, all of those black lines, those squiggly lines, those are the blood vessels sending oxygen and nutrition to every part of the heart. And as you can see, they're very nice, wide, and open. Contrast that to this picture. This is what Mr. Luhar's angiogram would have looked like. You can see how wide they are at the top, but then where these arrows are, there are lots and lots of narrowings, compromising the transport of oxygen and nutrition to various parts of the heart. So, at this stage, Mr. Luhar was advised by his cardiologist to have a triple bypass operation. So this kind of operation is where healthier blood vessels from a different part of the body, like the leg, are taken out. Your chest is opened up, and the narrow blood vessels are bypassed with those healthier blood vessels, so that oxygen and nutrients can get to every part of the heart again. Understandably, for all of us, I'm sure we would be a little bit scared by an operation like this, and understandably, Mr. Luhar was as well. So he came to me and he asked me, is there anything else I can do? And so I introduced him to the work of Dr. Caldwell Esselstyn, a cardiothoracic surgeon based in the Cleveland Clinic in America, one of the world-renowned cardiology and general clinics in the world. Dr. Caldwell Esselstyn has showed that he was able to successfully improve and reverse heart disease, not with a magic pill, not with a magic procedure, but with nutrition. So what did he advise his patients? He advised them to go on a low-fat, whole food, plant-based diet, which focuses on fruits, vegetables, whole grains, legumes, which are things like beans and lentils, seeds, herbs and spices. He cut out all animal products. And he also cut out the SOS. Can you guess what SOS is? Salt, oil, sugar, yeah. Or sugar, oil, salt, whichever way you want to say it. So, he made them cut out the big SOS, all right? Why did he do this? Because of something called nitric oxide. So we have blood vessels going from head to toe, and the blood vessels are supplying oxygen and nutrition to every part of the body. But they're not just tubes, they're actually living organs. The blood vessels make something called nitric oxide. And nitric oxide helps our blood vessels to relax, keeping our blood pressure safe and normal. But additionally, nitric oxide also protects our blood vessels from damage and inflammation, and therefore protects the blood vessels from becoming narrowed because of the collection of cholesterol. So nitric oxide is a really, really powerful substance. And it so happens to be that things like animal products and processed products like sugar, oil, and salt can actually reduce the reduction of nitric oxide, increasing the risk of furring and narrowing of your blood vessels. And whole plant foods do the opposite. Whole plant foods provide all the wonderful nutrients in order to protect your blood vessels, but also have the power of reversing disease as well. And this was shown by Dr. Caldwell Esselstyn. Now, if you look at this picture just at the top over there, it shows a picture, an image of the heart. And the red areas show good blood flow, good oxygen and nutrition getting to the heart. But as you'll see with the white arrow, there's a very dull area, and up from that there's a yellow section as well. That suggests that there's less blood flow to those areas. Now, if you compare that to the bottom one, you can see that there's far more red color going around the heart. So again, was this some kind of special pill? Some kind of special procedure? No. 3 weeks on a whole food plant-based diet, and you saw complete reversal of heart disease. Just 3 weeks. Now, if you look at this picture, the black and white picture, the first one just over here. So this is showing an angiogram again. And if you look at the top, the blood vessel is nice and wide. And as you come down here, it's very narrow. But again, on a whole food plant-based diet, without any medications or any procedures like the insertion of stents, the whole process was reversed. So now, on this picture, you can see how nice and wide the blood vessel is. And so the transport of oxygen and nutrition to the heart has been restored. So, coming back to Mr. Luhar, what did Mr. Luhar do with this information? Well, he was amazed and inspired by all of this. And in fact, we even got the chance to speak to Dr. Caldwell Esselstyn himself via Skype video. Mr. Luhar embraced a whole food plant-based diet. And who'd like to see what he looks like now? Well, it seems like I forgot to bring a picture. Sorry about that. But actually, not to worry, because he's here in the audience with us. Mr. Luhar, can you stand up and come to the front? So, amazing, right? Absolutely amazing. You can see the complete difference of how he is now to what he was 2.5 years ago. So an amazing, amazing transformation that you've just seen in front of your eyes. In just a few weeks of going on the whole food plant-based diet, Mr. Luhar was free of chest pains. He was now able to do his housework. He was now able to walk. He was now able to climb the stairs without having chest pain and breathlessness. Just within a few weeks. And a couple of months down the line, his weight was normal. He was no longer diabetic. He no longer had high blood pressure. He no longer had high cholesterol. And best of all, he didn't need that triple bypass. And he is actually medication-free. He is on no heart medications at the moment. That's the power of plants. That's the power of a whole food, plant-based diet. Now, food is an absolutely wonderful tool that we have. But we also have studies showing that other lifestyle factors are key to good health, and along with a good diet can help in preventing, improving, and reversing heart disease. So, by making the right food choices, exercising, sleeping well, relaxing, spending time with family, community, and in nature, and having life purpose, faith, spirituality. With all of these things, we can ensure a happier and healthier life for us and also those around us. Thank you so, so much.
Thank you very much, Dr. Shah, for that very insightful talk. And it's so great to see the effects of having a whole food diet in action. But of course, I'm sure Dr. Shah would agree with me that if you are making decisions to take alternative therapy, that you have to be guided by a qualified physician in that process. But it's so exciting to see this in action. I would like to thank all the organisers, North London Jamatkhana, for allowing us to be here today.